Hi, my name is Emily. I'm going to be your nurse today. Can you tell me your name and date of birth?
Kirsten Matthews, 10/2/2004.
Okay, do you know where you are today?
Hospital,
And do you know what today's date is?
April 3rd, 2020.
Alright, awesome. So everything is clean in her area. She's able to walk to the bathroom. Her IV is patent and there's no kinks. In her IV, she does not have any catheters, so there would not be any tubing that I need to check for. So I'm going to go ahead and go over a little bit of an assessment on you, and then we'll get into why you're here, okay?
Okay.
Alright, so I'm going to have you turn your head to the left, and I'm going to have you turn your head to the right. There's no JVD. Can you go ahead and push on my hands for me? And can you pull on my hands? Alright, awesome. I'm going to go ahead and look at your fingers, and your cap refill is less than 3 seconds bilaterally. Okay, do you have any pain in your upper extremities?
No.
No? Okay. She does not have any bruising. Her skin is a little cool and pale. Are you having any weakness today?
Yes.
Yes? Okay, so with what you came in today with, is going to tell you why you're weak, and it also is going to explain why you have some cool and clammy skin, because you do have symptoms of being diabetic, and when you are diabetic, it causes you not to produce as much insulin or any insulin. And then what happens is your body sends a signal that it's hungry, and that's when you start breaking out in the sweat and you become weak because you're not getting the energy that you're needing. Is your stomach hurting at all?
No.
No? Okay, I'm going to go ahead and take a listen to your stomach. Are you having any tenderness?
No.
No? Okay. Let me know if anything hurts when I'm pushing. We have bowel sounds ×4, which is good. Alright, I'm going to have you take some deep breaths for me, and I'm going to listen to your lungs, okay? Alright, I'm going to have you go ahead and sit up for me, and I'm going to do the same on the back. Alright, go ahead. Your lung sounds are clear, which is good. Alright, I'm going to go ahead. Any pain in your lower extremities?
No.
No? Okay. When was the last time you had a bowel movement?
Yesterday.
Yesterday. And have you had any gas?
No.
And are you having any trouble urinating? Any burning, anything like that?
No.
No? Alright, awesome. So if you have no pain in your lower extremities, I'm going to go have you no edema in her ankles. Cap refill is less than 3 seconds bilaterally on her toes. I'm going to go ahead and have you pull up against my fingers and pull down. Alright, awesome. So since you are having any pain in your upper extremities, everything is checking out for you and looking pretty good. So we're going to go ahead and talk about kind of why you're here, and if you have any questions, you can go ahead and ask me, okay? So you came in, your vital signs were fine, nothing really too major, but you also came in with, you had some pale and weak. You just were reading high on when we took a finger stick, which means that we pricked your finger, and we just took some blood and were testing what your blood sugar was. And the reason that we do that is a suspicion of diabetes and seeing if somebody, their body is working hard enough to produce that insulin for what the food that you're taking in, if it's able to even out and keep your body doing what it's supposed to do. So what we have found is that you are not producing enough or any insulin, and that's what's causing you to have these episodes of feeling weak and you're feeling tired. And so what we do is look at kind of your history and see if there's anything in your family. Do you know if there's any diabetes in your family?
No.
No? Okay, so what we do is we look at if you've gained weight or if you've lost weight, and you have lost 10 pounds in the last 2 months. So even though you're eating all the time, you're still losing that weight. And have you had an increased thirst?
Yes.
Yes. Okay. So with increased thirst also comes that it's a sign of diabetes. So we also look and see if you have a fruity breath smell, and you do. So that kind of shows some diabetes that also. So different tests that we will run on you are going to be a fasting blood sugar, a glucose tolerance test, a UA, which is a urinalysis, and that's going to test for ketones in your urine, so we can see if you have diabetes acidosis. And then we'll run a hemoglobin A1C, and that just looks at your blood, okay? Any questions so far? No? Okay. So what is some things that you can expect for the doctor to order is like a diet change. So making sure that you're taking in the correct amount of nutrition. And you are very thin and you exercise a lot, is what your mom said. So we want you to continue to exercise, but we want you to make sure that you are checking your blood sugar before you exercise, possibly during, and for sure after, so that we can see what you need to do before you start exercising. If you need to have a snack before, have a snack in between while you're doing your exercise, and if you need one after. And then we also will, the doctor will probably prescribe you some insulin. So that's an option. So in your chart it says that we're going to be treating you with that as DKA, which is diabetic ketoacidosis, for the next 2 days, and we'll go from there. Do you have any questions? No questions? Okay, so what we want you to do is going to be taking the insulin. And we will go and make sure that you are keeping your diet the way that it is, and that should help with your symptoms. So, you have any questions? You can read your questions.
Yes.
Okay.
What else can I take other than insulin? I hate needles.
You don't like needles? So, the other thing that we could do is prescribe you an oral form of medication. So, you will take that orally every day. And it can be used as an alternative, but the only thing that we like you to know is that it does not work the same as insulin. So when you take your oral medications, it's going to try to help with that glucose level and lowering it, but some people don't have the same response, and they don't respond at all. So when you do take the insulin, which is what we want you to take, would make sure that your body is actually responding. So everybody's body is going to respond to the insulin because your body is supposed to take the insulin. And since the oral forms are not the same, not always do they work. Do you have any other questions?
What can I do to help with this?
So you can make sure that you're managing your diet, checking the signs and symptoms. So if you're getting weak, you are starting to get sweaty, you can know that you're getting a low blood sugar and that you need to take something. By eating on a regular basis and at intervals will help. And if you're feeling sick and you're vomiting, making sure that you're still taking your insulin. And if you are not eating, you still want to take it, just because your body is still going to react even if there's not food. So making sure that you're drinking, if you're not eating anything, you can drink some sodas with a little sugar in them. And then if you are trying to eat some, you can go ahead and just drink diet soda, so that doesn't make your blood sugar rise even more. You also can eat like graham crackers and peanut butter to help raise your blood sugar if you're bottoming out. Making sure that you're not double dosing your insulin. So since you said you didn't like insulin, we could also give you like a pod that would go on your skin, and it would help give you your insulin, so you would only take one poke instead of multiple different ones with like the syringe and the needle. We also have the pins that you would dial up, and then you don't actually see the needle when you go ahead and hit one of your fatty portions of your skin. Like you could give yourself insulin in the stomach. And then we also have the pumps that you would put on and you would wear on your one of your pants or something like that, and then hide it with your shirt. So making sure that you are using it correctly is going to help, or using any of the methods that we do have for you will help that as well. Any other questions?
No.
No? All right, so that's all I have for you right now. I'm going to go ahead and let you rest, and then I will be back in here in a little bit to check your blood sugar again, okay?
Okay.